Fear is a normal, healthy, and often life-protecting reaction. Fear puts the body in a kind of alarm state. In this way, it prepares itself to defend itself against dangers. But sometimes, everyday situations trigger anxiety reactions that are so intense that they hinder normal functioning. If this lasts longer than 4 months, we call it an anxiety disorder. The cause of this is not yet completely clear. Various factors can play a role. Some people seem more vulnerable to it than others, and family studies also point to a hereditary sensitivity. It is thought that certain substances in the brain, neurotransmitters, play a role in the predisposition to anxiety or panic. Past experiences and learned responses, including through upbringing, also partly determine how you deal with feelings of anxiety. There are different types of anxiety disorders. Panic disorder. People have panic attacks, with also fear of the attack itself. Social phobia. One is very afraid of the reaction or criticism of other people. This mainly occurs in social situations such as at work, in a restaurant, when in contact with strangers, at a meeting. Specific phobia. One has a fear of certain situations or things. This includes fear of heights, fear of darkness, small closed spaces, claustrophobia, fear of blows, spiders, and insects. These are the most common phobias. Post-traumatic stress disorder, PTSD. This typically arises after an unpleasant experience. You often relive these experiences in your thoughts or dreams. Obsessive-compulsive disorder, OCD. This involves recurring obsessive thoughts, obsession, and compulsions, compulsive. Generalized anxiety disorder. This disorder manifests as constant, difficult to control anxiety, such as excessive stress and worry about everyday matters and the future. This form often occurs in combination with other mental disorders. Anxiety disorders are among the most common mental disorders, and they usually develop between the ages of 15 and 30. It occurs twice as often in women as in men. How do you recognize if you have an anxiety disorder? During an anxiety attack, you may have one or more of the following complaints: nervousness, restlessness, tightness in the chest, feeling of suffocation, palpitations, sweating, chills, nausea or abdominal complaints, dizziness, trembling, the feeling that you are going to faint, tingling or numbness in the hands and or feet, headache, muscle tension in the neck and lower back, fear that you will go crazy or even die. How can you deal with that disorder? No matter how difficult it is, don't try to avoid situations that make you feel anxious. It is important to realize that if you do not do this, you will feel more and more anxiety over time. Write down what you think and feel in situations that cause you fear and how you respond to them. Find relaxation. This way, you can distract yourself from the fear. Seek support from people you trust. Avoid too much caffeine and alcohol, as these substances can trigger or worsen anxiety symptoms. Treatment from a doctor. A doctor will first determine whether and from which disorder someone suffers. The doctor would then inform you how you can try to deal with this. Severe anxiety disorders are treated with a combination of psychological help and medication. Cognitive psychotherapy, also called cognitive behavioral therapy, is the best scientifically based therapy for anxiety disorders. Sometimes, it may be necessary to also use medication. Usually, a medicine from the class of antidepressants is chosen. It is best to avoid sedatives such as benzodiazepines, even if they reduce symptoms in the short term. Because of their fast effect, you are more likely to take them quickly, which can cause you to become addicted to the medication. Always talk to someone about your problems or seek help if you really need it. Thanks for watching this video. Like and subscribe.